na mbere ni ati kanjo ya magavana ni nyitanĩire na rũhonge rwa ũgima mwega wa mwĩrĩ nĩguo kũgacĩrithia ũgima wa mwĩrĩ thĩinĩ wa mũingĩ oro ũndũ ũmwe na thĩinĩ wa bũrũri witũ wa Kenya. Na mũtaratara ũyũ wambĩrĩirio mwaka wa 2025 na wambĩrĩirio nĩ rũhonge rwa ũgima wa mwĩrĩ nĩguo kũheana macini cia kĩrathi kĩa igũrũ thĩinĩ wa thibitarĩ igĩrĩ o kaunti iria irĩkoragwo igĩteithĩrĩria arwaru a mũrimũ wa cancer oro ũndũ ũmwe na mũrimũ wa shukari. Na muthenya wa ira ni maikorirwo mena mubango uyu ni undu wa gucokereria ruhonge ruru rwa NESC na ugukorwo ugitongorio ni thirikari ya kibũrũri manyitanire na thirikari cia kaunti no undu uyu urakorirwo ukiariririo thutha wa mucemanio wa thikũ igĩrĩ uria urakorirwo ugitafanio kuria mwena wa Naivasha kaunti ya Naikuru.
We have had a sensitization session with the governors and the Council of Governors, and we are in agreement that now we go and start the rollout of universal health coverage, which was the promise that His Excellency the President gave. So we are good to go from here, and the ministry is ready. We start rollout in annex. But I also want to thank the governors that finally we have now executed the IPS, and that moving forward the noise that has been around on the medical managed equipment services, that has been put to an end, and as a ministry we have been given the mandate by the governors to proceed and get into service level agreements that shall ensure that services are provided at the county facilities. Thank you very much.
The Council of Governors, together with its partners, convened a 2-day consultative meeting between the national government and the county governments to review the intergovernmental relations and engagements between two levels of government, with a critical focus on health and social protection sectors.
Today we've witnessed the death of MES, or the MES, and we have now a new scheme called NESC, which is the National Equipment Support to Counties by the national government, which we have varied history on how the MES was consumed, or rather consummated. We are now on a new level where our interest is the service to the people, as long as the national government is providing the equipment. And we are convinced beyond any reasonable doubts that we have done the right decision. That is why we have signed today, because we need the equipment irrespective of the model of engagement with the vendors. Because as counties, as we are consumers, the agreement between the national government and the vendors is something they have already put in place, and they are satisfied that it is a good relationship. Otherwise, they would not have had us to sign the agreements today.